Well, it's very good to have you with us today, Catherine. Thank you for taking our time. I know you're incredibly busy. You're probably making some preparations to go back to work, and it's complicated in our field. And then you are president of ASRM. You're an embryologist, lab director. It's quite an incredible combination of things, particularly in this time. And we are so grateful that you are our leader, and that has shown in the last few months. But let's take it easy for a little bit, and maybe first you can talk about where you come from. When did this all start for you? Where did you study?
Absolutely, Jacques. Before I respond to you, I really would like to thank you and your team for inviting me to participate in this video. I'm really honored and humbled to be here. So where on earth did it all start? Well, it started way back when I was a PhD student in Cambridge with Brian Heap, where I was studying embryos. And then at that time, of course, Septo and Edwards were really trying to develop IVF, clinical IVF. And I would occasionally go to the Department of Physiology in Cambridge to listen to Bob Edwards on a Friday. He gave Friday lunchtime seminars about clinical IVF and his progress. And this was in the early to mid 70s. Now I'm going to date myself. But it was just really exciting to listen to him explain and discuss the challenges that they were facing. And I'll never forget the one occasion when he basically said, I am not sure this is ever going to work. You know, of course, you knew Bob very well, Jacques. And so you knew that, you know, he had this amazing black hair, really thick black hair. And I remember him running his fingers through his hair, like, and making his appearance look like Einstein. And he just stood there in front of all we students saying, I'm not sure this is going to work. And it was a really profound moment for me. I was at the time working actually on pig embryos and studying implantation. But the fact that this eminent, obviously incredibly capable man felt that this may be a challenge that he's taken on that he may not be able to meet was, I think, a moment of realization to me that you just stick at it. And I carried that with me actually through my career, that moment when he said that.
Yeah.
So fast forward from then, I then ended up at Harvard as a postdoc, initially with Koji Yoshinaga and then with John Biggers. Most of the time it was with John Biggers. And, you know, as you know, he was English, and we English have a very, you know, special bond, I think. We were very able to laugh at things that the Americans had no idea what we were laughing at. So we really had an amazing scientific relationship and collaboration. I was very sad to leave his lab, but I left his lab as a result of a man who carried me off to Arizona. And so I was in Arizona then for several years, actually many years, if I had to count them, close to 15, 16 years, I think. Initially at Arizona State University and then at the University of Arizona. So at Arizona State University, towards the end of my time there, I succumbed to infertility. And I actually had 5 years of infertility and went through 2 GIST procedures and finally conceived with intrauterine insemination. It's low-dose pergonal, IUI, and conceived with triplets. And this was like a game-changing moment for me, obviously, having gone through 5 years of infertility and then finally to be at the point where I actually was pregnant was absolutely amazing. And I did not care that I had 3. In fact, I was elated. And so it was shortly, sort of, I guess, I don't know, several months into the pregnancy when I realized that with my basic science training and the fact that I had had infertility, that it was a natural segue for me to be a clinical ART lab director. And I sort of made this promise to myself that I would become an ART lab director, you know, within a few years of the children being born. I actually had an R01 grant at the time. I was starting I think it was the 2nd year of it. It was a 5-year grant. So I obviously had an obligation to that. But in any event, shortly after the children were 4, I then took my first IVF lab directorship. And that was at the University of Arizona. So that gives you a little bit of a brief background on.
Yeah. So, and what year are we now? What year are we talking? You can cheat.
So, yeah. So I moved to the U of A in 1991. And I would just say a few words, like to say a few words about my triplet pregnancy, just for anybody who listens to this who is pregnant with multiple. So if you don't mind, may I just say a couple of words?
Go ahead. No, go ahead.
Thank you. So, I mean, obviously a triplet pregnancy is a very unusual situation for a woman to be in, and it can be incredibly challenging. But I was lucky in that I had excellent medical care. First-rate medical care. I was under the care of the high-risk perinatologist at the Good Samaritan Medical Center in Phoenix, and I was on bed rest for weeks. Actually, it was months. From the 18th week of pregnancy, I was on bed rest at home, and then I was on bed rest from 23 weeks on in the hospital, and they were born at 35 weeks. And I just want to mention this because I want to tell people who might be in this situation that you just have to do everything that you're told to do. I was incredibly lucky that my children were born with no problems whatsoever. I have 2 boys and a girl, as you know, Jack, Adam, Lauren, and Daniel. And I was just very, very lucky. They were born at the end of the 35th week with no problems. But this is certainly not always the case with a multiple pregnancy. So for anyone out there who has a multiple, whether it's a twin or a triplet, actually, and of course in our field, we're always striving to have neither, to have one single healthy baby for every patient. But if you happen to be one of those patients, I strongly advise you just to do everything you possibly can, because these are high-risk pregnancies and they really need to be taken very, very great care of. So thank you for letting me just have that little sideline.
Well, you're welcome. And I was going to ask you, but you were ahead and you explained it so well. Of course, we've seen an incredible change in our generation, right? With multiple pregnancy, it's one of the most remarkable changes we've seen. And naturally, you get somewhat of a dip in outcomes, in some outcomes. But if you look at it per embryo, it really has not dipped. It only has gone better and better each year. So how did you go from doing all this, which, you know, doesn't sound very easy to me. And I think I met you the first time I met you, you were in Arizona, and I was surprised when I heard you speak and you said you were from Phoenix, Arizona. So how did you go from that to, you went back to Harvard, you went back to the Northeast, obviously John Biggers played a big role and a draw, I'm sure. How did that come about? The job became available, or Brigham and Women's?
So what happened was at the time, this we're now talking 1996, late 1996. In fact, it was the ASRM meeting of 1996. I was fortunate enough to win the SART Prize Paper Award. And in the audience was my previous division chief. And I think, I'm not exactly sure, but my understanding is there was some discussion between John Biggers and my previous division chief that I should be brought back to Harvard as the IVF lab director.
Well, there you go. Yeah, obviously.
So this was, it was probably, I'm talking maybe late November, early December of 1996. My telephone started to ring in my office. And I spoke to him several times. I would guess probably half a dozen times before I agreed to go to interview. And the reason why it was so difficult for me to make that decision was because I'd really put my heart and soul into the program at the University of Arizona. There was just myself and one other young lady who was helping me. I ran the hormone lab and the IVF lab. We were doing over 200 cycles a year, and it was literally just myself and Teresa. And it was a really, you were there. It was such an exciting time in our field. There was so much we didn't know, and we were groundbreaking. And just the thrill of the chase every day, as it were, to get fertilization and to examine the embryos, understand everybody that at that time there was no training in clinical IVF at all. So when Jean-Pierre Palermo published his first paper on ICSI, which I believe it came out in 1992, if I remember correctly, I was absolutely thunderstruck by that paper. And I decided that I was going to establish ICSI at the University of Arizona. And unfortunately, I met with a fair amount of resistance there. It was basically thought that it would never work, in inverted commas, and that I'd be wasting my time. And I was doing Susie before that, as probably you were as well, with a really high incidence of triploidy rate and very low diploidy rate, and it was very frustrating. Yep. So the resistance was so severe that I was basically told that the university or the department would not fund me to go to Belgium to take one of the courses. So I said, darn it, I'm going to go myself. So I paid my own way for the course and for my fare, and I used vacation time, and I went there and I took, I think it was their second course.
Right.
And
hundreds of people, right? Hundreds of people, I think there were.
Absolutely. Yeah, it was really big. And I remember they had this enormous screen on one wall of the auditorium where you could see eggs being injected, and it was so exciting. Yes. And I remember writing my protocols when I went back to my B&B at night, and then returning to Arizona going, oh God, now I've really got to do this. And so, you know, I had no equipment at all. So I bought a tungsten wheel, you know, to grind the needles, to bevel them. And I managed to find in the Department of Anatomy in a closet a microscope with a sufficiently large clearance so that I could make some sort of a microforge. But the problem was the lens kept blackening on the microscope. So, I mean, I had to work all these things out. Probably the funniest part of all this, other than the angst.
People who are listening to you won't know what a microforge is. Can you maybe explain it? What is it?
Sure.
Yeah.
Yeah, of course. So a microforge basically consists of a power pack, and it consists of God, I think it's platinum wire, if I remember correctly. I bought platinum wire. Yeah. That you attach, you have to develop the whole thing in such a way that when you turn the power pack on, the platinum wire heats up, and you have a glass bead on it so that it distributes the heat appropriately. And when you advance a pipette towards that, it starts to melt the end of the pipette so that you can make it nice and smooth. So in other words, we're now making holding pipettes, which are available today. But in those days, none of the pipettes, neither injection or holding pipettes, were available. And so we had to make them by hand. Yeah. And I remember going to Home Depot and buying a power pack and making my own microforge. Yeah. And as I say, I found this microscope with sufficiently large clearance so that I could do this work. It was probably the biggest challenge of the whole thing, other than securing the platinum wire, was actually securing the glass capillary tubing. And I'll never forget the day when the delivery man delivered my glass rods to my office. And basically it was like a 4 or 5 foot high package comprised of probably 300 glass capillaries. And, you know, they were really, really long. And he said, Dr. Racowsky, what are you going to do with these? And I said, well, I'm actually going to probably, if at best, probably use only one of these. And I'm going to make these tiny little pipettes. And he just kind of looked at me as though I was completely and utterly nuts. But that was the only way I could find the glass of rods that were sufficient to be able to do this. So it took me a day to make sufficient holding pipettes and injection pipettes for one case. And it was really tricky. I remember, you know, with my tungsten wheel, I had a protractor to get the angle of the bevel right. I mean, this was really all incredible.
You know, people don't realize that, the embryologists nowadays don't realize that it's only been 20, 25 years since you can buy these things.
Exactly, exactly. And yeah, but it was, although it was extremely challenging, it was so exciting and so satisfying. And I was particularly satisfied because my very first ICSI patient conceived. Yeah. And I'll never forget, of course, I made a complete idiot of myself, but I tend to be, you know, a little bit like that. So they arrived after the baby had been born. They arrived in the waiting room and they wanted to see me. And I went and I saw this little boy who looked the spitting image of the father. And of course, I just burst into tears in front of all these patients. I was so excited. It was just such a sense of accomplishment when I'd been given no encouragement whatsoever to get this program started. And we basically became the male factor center for the Southwest in those days. Right. I mean, there were like five states. People were coming from all over the place, you know, to have their male factor solved. And it was really amazing. So as a result of all that and feeling like I'd played such an integral role in getting that program established, it was really hard to even think about leaving.
Yeah, I can imagine. You know, and there was also in those days, I feel that not everywhere, but there was quite a bit of pushback in terms of treating male factor. I mean, that was not, for some reason, for some odd reason, that was not considered state of the art or sort of an after fact. I mean, it was obviously all very driven about female patients by men who were in charge and doctors. Mostly they were driving this whole argument that, you know, the reason was reproductive urology really as a profession did not exist. Yeah. And so, you know, people, you know, authorities in the universities would kind of criticize you for doing male factor or being you know, they weren't really interested. Maybe they weren't criticizing, but they weren't really interested in it, right?
Right. I think you're absolutely right. And I think, you know, the other part of this, of course, was that I think probably there are some men who never want to think it's their fault, in inverted commas, that the couple has infertility. It's not the woman or the man, but it's the couple or the individual, if it happens to be a single person. And that was a big barrier, I think, to have to break down for people to accept that this actually involves both the man and the woman, and that this is only about, what, 40% of the time, is it woman, 40% guy, and 20% both?
Anyhow, we don't exactly know the numbers, really.
Right. But it's a high percentage.
Yeah, it must be a very similar number. We know a bunch of them are unexplained, and then it's sort of 50-50 between the remainder of men caused by the man or the woman. I mean, we're pretty sure about that, but we don't know exactly what the incidences are, because we don't leave patients there dangling out. They merely have options. So the you know, the etiology of it becomes kind of lost over time.
Yeah. Yeah.
All those papers are based on 40s, 50s, 60s research.
Right.
So how do you go from there? So you're back in Harvard, and then you. And
so anyway, so I go for the interview, and I remember when I was getting on the plane, flying from Tucson to Boston, going, well, this is going to be a big turning point in my life. I mean, I made the decision to go for the interview. You know, I really loved my time at Harvard, and having made that decision to go for the interview, I realized that this was probably going to be it. And so I went for the interview in the January of 1997, and in April of 1997, I was on board as the lab director. And there was a lot to think about. You know, I'd come from what was myself and one other person, embryologist, knowing that I was going to be leading a very large team. And actually, when I went to interview, it became very obvious that I was going to need to make some rather substantial changes. Just because the way that the culture system was set up was not what I was using at the University of Arizona. It was actually quite like the Louise Brown's culture system, with the open organ dishes, without oil. There were towers of dishes in the incubators, literally, of the 37 dishes. And so I knew that I was going to have my hands full, because nobody likes change. And there was going to be a lot of discussion about changing the culture system, and God forbid it better work, although I was using microdrops and oil in Arizona and it worked beautifully. But in any event, so I took the job, and so the first day I was on the job, I'm summoned into my division chief's office, and he said to me, and these were very wise words, which I just like the Bob Edwards words. He said, you have these phrases in life that you're delivered. And I'll tell you something about Professor Amoroso shortly, actually, at Brigham. But what my previous division chief said to me, he said, now, Catherine, he said, I want you to understand that in Arizona, you were a very big fish in a very small pond. You're now one Arabian horse amongst many in a very large stable. And I crept out of that office like feeling like the size of an ant.
It's so true. Yeah.
But it was actually really, this was day one on the job. But it actually was, I think, an incredibly important thing for him to say to me. Not that I thought for a moment that I could just go, bulldozing in and make every change that I wanted to immediately, but it was very sobering to hear those words.
Yeah, I can imagine. In Arizona, you were famous. People recognize you on the street, probably from what.
Not quite.
But I can just imagine you in newspapers and your heavy step clinics.
I actually was. In fairness, I did go on the radio, the television, a fair amount.
There you go. And whereas in Harvard, even if you are on television or on radio, so is everybody else.
Exactly. Who cares, right?
But if you had done all that, what you did in Arizona and in Harvard, they would have bought you a microforge, or they would have found a microforge.
They would have, absolutely. And I mean, the day I left, I was still using my handmade microforge.
I never heard of anybody who couldn't afford a microforge. That's fantastic. Although they were about 10 grand, though. They were pretty.
Yeah, they were pretty expensive, actually. Yeah, I mean, particularly in those days, 10,000 was incredible.
You had to blow air on it, and you had heating and blowing air is what made the form of the glass.
Absolutely, that's right. I forgot that bit.
Under the loop, yeah.
That's right.
Then you had to break it, and then finally you had to put a needle tip on it if you could grind it. Yeah, wonderful, wonderful stuff.
Back amazing memories. So I think one of my sort of key contributions to the clinical field was some of the work that I did with John Biggers after I'd returned to Harvard as the clinical IVF lab director. And of course, this relates to all the incredible work he did on KSOM and the culture media that he developed in his lab for supporting mouse embryo development right the way through from the one cell through to the blastocyst stage. And so at that time, of course, David Gardner had developed his two-step medium. And I was having lunch with John on the Harvard Quad one day, and I was telling him about this two-step media and how, you know, it just seemed odd that an embryo would actually have to adapt to a different media just at the time when the embryonic genome was being activated. And so John and I just chatted about it. He said, well, you know, Catherine, I've got this media that my lab's been developing, which, you know, is incredible at supporting mouse embryo development. Why don't we try it in the human? So we set about, you know, designing an experiment on a napkin, as one does. And, you know, within short order, we'd actually tested whether KSOM as the second stage media actually was capable of supporting a human embryo development right the way through. So that was, you know, for me, that was just such a pleasure to be working with him again. I stayed in extraordinarily close contact with him all throughout the time that after I'd returned to Harvard. He was one of my best friends, actually. Sure. And again, you know, he was English, and we had this wonderful sense of humor that we shared together.
Yeah. So if we then move forward just a few years, because I think you probably have been involved with ASRM and organization of ASRM for probably about 15 years or so. I don't know if I'm getting that right, but
yeah, you actually are just about right, I think.
Yeah, it must have been quite a long time. So it's not that you can apply for the job you have now at ASRM, right? There's no advertisement in the newspaper. Presidents want it, right? So you have to evolve to become president of ASRM or chairperson of ASHRE. This is not a process that is given to you. And if you have 300 publications or 150 or 10, it makes no difference. It all depends on what you do before. So how did you do it? How did it happen for you? It's a long process.
Yeah, it certainly was a long process. You know, I very much believe in organizations like the ASRM. I think that just having groups of people and sharing ideas is you're so much stronger a person, not just as a researcher, an embryologist, but just as an individual if you share ideas. So I was interested very early on in becoming a member of the ASRM, although I will say, just as an aside, having been a member of SSR and going to those meetings in t-shirts and a pair of shorts, the night before the first ASRM meeting I went to, I had none of the appropriate garb and I had to fly off and buy a suit. That is literally, I had jeans and t-shirt. But so I got involved fairly early on. I think I was very fortunate, frankly, Jacques, because there weren't very many of us, if I may explain that, people who had a very rigorous training in basic reproductive physiologists who then became lab directors. And so we were a fairly sort of small group of people, I think. And as a result of that, if you were doing research as well, which of course I was, then you immediately start getting noticed because you're presenting your work. And I presented my work a lot at ASRM meetings, you know, both in oral and poster form, on all sorts of different things, ranging from, I don't know, human eggs from oophorectomy specimens to the effect of nicotine and caffeine on embryo development in the mouse or the rat. So I got sort of established as somebody who was not just a lab director, but someone who really had this underpinning of basic biology behind her, but also this incredible drive just to keep moving the field forward.
Yes.
And so I was invited to become a member of the practice committee. That was a little bit later on, but I think the very first sort of thing that got me on the way to becoming president of the ASRM was I was asked to become secretary. And in fact, it was a vote, if I remember correctly. Or maybe it wasn't. I think it was an appointment.
You were secretary for the longest time, right?
I was. Because at that time, it wasn't a voted, it was not a voted position. So I just was secretary, and I kept being secretary year after year. It finally became a position that you had to be elected into. And luckily, the last time, my last term as secretary was a voted position, and very fortunately, I was voted into it. Right. But I was secretary, I believe in 2006 was my first year as secretary.
Oh, yeah, okay.
So, it was a long time ago. And then from there, I was asked to join the presidential chain of the ASRM, which was just an incredible honor. It was a little bit daunting. I'm only the second Ph.D. Who's president of the ASRM, and I'm the first clinical embryologist. So it's a big responsibility for lots of different reasons.
Yeah. Yeah, Don Wolfe is sort of the only person who comes close, probably, although he was more of a basic scientist or a clinical scientist rather than an embryologist. You must be the first clinical embryologist.
I believe I am. That's what I was told anyway. I haven't checked.
Yeah. And so the coincidence, or maybe it isn't a coincidence, of course, is that Christina Magli has a similar background and is also in that role now in Ashford. And that's what's driven us to get the two of you together. So we have about 10 minutes more or so. ASRM today, particularly now, is completely different from what it was a year ago. And that is completely different from what it was 5 or 6 years before that. The difference is remarkable. I always found it an organization that was behind a little bit. It wasn't making decisions very rapidly. It was, and it couldn't, in a way it couldn't. But because of the situation, the changing situation, and since all fields in medicine have been data driven, all of that has come into place. And now we see they're ahead, you are ahead of the curve. You're sending us emails and announcements and video and webinars, and we're making notes and trying to match those criteria and suggestions. You strongly suggest, of course, I mean, we are, it's not like the Japanese Reproductive Society, which dictates. Right. You're not necessarily in that position, I think, but you're as close as you can be. You strongly suggest to do the following. That has been a remarkable change. And I can't help, of course, being your friend, but also knowing you for such a long time, I can't help to think that you're a little bit behind that, right? You must be a little bit involved in that change.
Well, a little bit. I mean, I will take a tiny little bit of the credit, but frankly, I mean, most of the credit in terms of the change since I've been president, frankly, has really been driven by Ricardo Aziz, who's our new CEO. Having said that, though, I mean, it takes a team. It's, he really believes in communication. He really believes that a society is only as strong as the members, which of course I do. And communication is the foundation of that. So we've made a huge effort, and I'm so glad that you're mentioning this and you've appreciated this. We've made a huge effort to really enhance the ways in which we're communicating, all sorts of different ways with members. And then, of course, with this ghastly pandemic that reared its ugly head, it really sort of catalyzed us into becoming, almost overnight, expert communicators. And I'm sure, you've read the guidance documents that we've been putting out on COVID, and it's been, needless to say, an interesting ride. I really do believe that we've done the right thing, but there's been a lot of pushback from various IVF clinics, unfortunately.
You're now keeping us abreast. You're saying the next document is coming in 10 days, 9 days. There's a countdown. It's remarkable, and we're relying on it. We're looking out for it. So thank you for all of that. That has been such an amazing change, and I think all of us are proud to be ASRM members now. This is a totally different
that makes me so happy to hear that, Jacques. Thank you very much, because it does take a huge amount of work to keep up with the communication at the level that we have. And I would like to take the opportunity to really commend the ASRM staff in Birmingham. They are absolutely magnificent, and they have stepped up to the plate in a way that one couldn't even imagine as a result of the pressures that have been on us. So thank you.
Yeah, no, thank you. So during your, I think you're another year, right? You have another year? Or
no, the presidency is just 1 year.
It's 1 year, yeah, that's right.
It's actually a 5-year commitment. So I've been on the president. This is my 3rd year being on the presidential chain, and then I have 2 more years afterwards. So it's very like nice continuity.
Yeah, it's like a wave, which is a great idea. So the presidency is 1 year, but you're a president-elect, and before that functions in that little team, and then it's like a wave that you move through. Exactly. And they keep people, so now you'll keep on for another few years, I think, right? Yeah.
So my term ends in October, and then I'll have 2 more years after that on the presidential chain. So it works very nicely to have that continuity.
Yeah. So until October, it's still an incredible challenge because of the current pandemic and the situation that clinics are in. You know, in the absolute necessities of humans is eating, drinking, reproduction, and sleeping.
Yeah.
There's not much else, I think. I hope I haven't forgotten anything.
I don't think so. Laughter. How about laughter?
Okay. But you can do without laughter and live okay.
You can.
Unimaginable for me, and for you, I think. I mean, those are the necessities, and reproduction was there for a while, of course, was considered non-essential. So odd to consider reproduction as non-essential, but we were hoping that it was for 4 weeks, 6 weeks, and now it's 10 weeks and 12 weeks and a slow start, which was all predictable when you looked at the other countries. This was all predictable.
Absolutely.
Absolutely.
Yeah.
What about ASRM? What about the meeting? You don't have to answer if you.
Well, I mean, no, I'm happy to answer. I mean, of course, there are so many uncertainties at the moment, and this is one of them. We don't know whether we'll be able to have an in-person meeting or not. We, of course, very much are hoping to, and we're still planning for one. But we're also planning for not having an in-person, or perhaps having a hybrid. I mean, it may be the case that we could have a much smaller in-person meeting and then a lot of virtual as well. We just honestly don't know at this point. We've got to make a decision within the next 2 months or so because of all the contracts and things that are involved. But the real goal is that we will have the meeting if we possibly can. But I mean, I think we're all so used now to this virtual communication.
Yeah, it's not so bad, right?
It's actually not so bad.
It's not bad at all.
You can get to see people inside of people's houses, right? Okay.
So other than the pandemic, which is an incredible challenge, there are no words for it to describe it. What other challenges do you have for ASRM and this coming meeting? What other things are playing? You're changing the organization, so I can't imagine there could be more than that. But is there anything that you like to say about the challenges ahead for you and for ASRM?
Well, I think there are technological challenges, aren't there? There's all the CRISPR gene editing challenge, which is absolutely huge, which is really being pushed to one side at the moment. Yeah. But germline gene editing is not going to go away. Yeah. And in fact, I was very fortunate to participate in a workshop at the Royal Society last year in London on this very matter. And some of the top people were there thinking about all these issues and how on earth we're going to actually control and manage them. Yeah. So I think, there are all these technological issues that are bubbling up, and many that we don't even know about, which I'm sure are there, are just ready to start moving into this vacuum once hopefully we get a vaccine for the pandemic. Yeah. In terms of the actual society itself, what I'm hoping and really expect to happen is our society will continue to move forward in this very sort of, I wouldn't say aggressive way, but competent way to really improve involvement of members. And one of the things I'm particularly interested and concerned about is frankly bringing many more younger members into the leadership positions and into having a say in how the society runs. They're the ones who are going to be carrying the baton when you and I are not. And I think it's incredibly important that we continue to make every effort to involve them.
And what about woman-man ratio, female-male ratio? If I looked at the ASRM board, it's 6 women and 14 men, which is not reflective really of our community, our profession, where it's the other way around.
Yeah.
And I'm sure this will be changing. I think 6 women is pretty good. I may have counted this wrong. It may have been 7. And then you have 17 MDs and 2 PhDs.
Yeah.
Considering all the entire proportion in our field, the number of PhDs is pretty small.
Actually, there are 3 PhDs on the board at the moment. There are 3.
Well, there are a couple of MD PhDs too, which I didn't count. But so, okay.
No, but there's Amy Sparks, there's myself, Amy Sparks, and Shane Zazula, who is president.
I have that name down as it says on your website, it says Bachelor of Science.
Oh, I beg your pardon. You're right. I'm sorry, he's not a PhD.
Which I think is fantastic because they need that representation.
Absolutely, absolutely. So to your point, I mean, you're absolutely right. I mean, we've got to, continue to address this. It's not something that, frankly, I've never really, and maybe I should be careful what I say. I just feel that people should be put into positions because of their abilities. Yeah. And not because of their gender, their sex, the color of their skin, whatever.
But you have a lot of people in our community, and you sort of have to open it up. There's a lot of people who are shy and don't come forward.
Absolutely.
And those are brilliant people, and so if you really want to, you can find it. I mean,
absolutely.
Men are just more forthcoming and saying, "I'm here. Do what I can do." As women, there are some women like that, but not many. And so you need to kind of open it up.
I agree. And there's actually some very interesting research that's going on in that regard. So for example, how often do women ask questions at the mic in open oral sessions, for example? And there's somebody at the University of Arizona who's actually doing some work in that. So, I mean, these are important issues, and thank you for raising them. And this is not something that, is gone behind at all. It's up at the forefront.
Right.
So you asked the question, what would I say to anybody who was hoping to sort of follow in my footsteps? Well, I'm very humbled even that you'd asked that question, Jacques. I am who I am. I work really hard. I think working hard and being very persistent and not giving up are key. They're sort of ethical things that I was brought up with. You just don't give up. And so when I was trying to set up the ICSI program, I just didn't give up. I just kept going at it. So I think that, but I also think there's a lot of luck. Grab hold of opportunities, even if they involve risk. Nobody likes necessarily to take risks. We all like to feel secure, but risks are important. Risks force you to challenge you to do better than you are at that moment. And so I think that would be my other piece of advice. I've been very fortunate. I was presented opportunities that involve taking risks. I mean, just going back to the Brigham and Harvard when I did was a risk. I was very comfortable at the University of Arizona, but I decided to take that risk.
Yeah. I know the feeling.
I'm sure you do. You've taken many in your life.
It's hard when it happens, but there's a little voice that says this is probably okay.
Yeah, exactly.
Yeah. Okay. It was great talking to you. I'm very excited about this interview. Hopefully it was all recorded.